So we're going to move on. I know we're going to close things out shortly, but I think we can't close things out without doing a couple of very important thank yous. And I want to start with our finalists. I know that we kicked this program off, I want to say I think during National Nurses Week during May. And the team started working feverishly, through the coming months to, build their ideas out, meet as a team, get coaching and counseling from such a large group of individuals. And you can imagine what you saw here was the 10 finalists. There were many other groups behind this, but I just want to say congratulations and thank you to the finalists for all the work that you have put in from day one to get us to this point today, because you got it down. Your presentations were tight, they were polished, they were on time, and that's sometimes such a hard thing to do if it's not something you're used to doing on a day-to-day basis. So congratulations to all of you, and again, thank you for the time that you have put into this as a whole. Do you want to go to the next slide, Nico? I think it's safe to say, and I've already kind of referred to this, that you looked at the problems we were talking about from so many different perspectives and came at it from so many different angles. And it's just amazing what 10 groups can do, and you can look at the variety of things that kind of came up across the presentations. But if you think about how this whole thing came about as a whole, as you might imagine, for those of you who weren't involved in the day-to-day, it literally was a whole community of individuals that came together to make this happen. So we can go to the next slide, Nico. We had inspiring mentors along the way to kind of, help people kind of figure out the ideas and move. We had encouraging pitch coaches who know how to really put together a tight presentation. We had thoughtful judges who are about to, kind of share their findings with you. And I know they put a lot of deliberation into, the exercise this evening. We had some thorough reviewers. To get to this point, we had a whole slew of reviewers, as you saw earlier, who put their time in to really go very carefully through all the applications and to arrive at the top 10 finalists. And of course, we had very knowledgeable workshop leads along the way, because we know that to get us to this point, there was some core education that we wanted to make sure as sponsors that we're able to help present to you to help encourage you and help you shape your ideas. And of course, I can't go any further without thanking Dave Upton, who's been our diehard tech support from Microsoft from day one on this entire project, just like he's been with us on all these Nurse Hack for Health events in the past. Dave knows teams like the back of his hand, and he's helped us out in so many different ways over the past 3 years. So thanks to Dave for being with us here again. And I think it goes without saying, we can't, close out the evening without a special thank you to the Northwell Nurse Choir. Just an amazing, amazing group of individuals, professionals, again, people who are on the front lines, giving it all, who still find time to go out there and perform, to inspire others and hopefully inspire themselves at the same time. So where are we going from here? We're going to get to the announcement in just a moment. But before we do that, just wanted to let you know a few key things. First of all, we have ongoing innovation opportunities in front of you. For everyone who applied this evening and our finalists, as well as the past teams, as many of the other teams are on the call tonight, there's another new round of funding that's available through All In Wellbeing First for Healthcare. And you can apply, even if you applied to this particular event this evening, you can also apply there for additional funding. It's at allinforhealthcare.org, and I encourage you to check that out. And also, our presenting sponsor are already talking about what the next Nurse Hack for Health pitch event could look like in 2023. So stay tuned on that. We love these events. I will tell you, hopefully you found it energizing. We all do as well. It's something that you plan for months, and you come to these events, and the people you come, in contact with, the ideas that you hear are just truly inspiring. And so we want to keep this thing going. We're also going to be sending a post-event survey to all of our finalists shortly thereafter, after this call, and probably in the next week or so. And also, we wanted to encourage all of you to stay connected to us. If you go to the next slide, there's just obviously with all of our presenting sponsors, there's a variety of ways to do that, whether that's through Twitter, Facebook, LinkedIn, Instagram, what have you. If you are enjoying this content and what we're putting together, we would love to stay connected to all of you, because again, I know we feel from day one that we have been building a village of people who are like-minded, who value the importance of nurse innovation in healthcare. So thank you to all of you once again, and I'm going to turn things back over to Kasia to get us to what we're all here for. So thank you.
Thank you, Linda. So first and foremost, I would love for all the participating teams to turn on your cameras as we go through the next slides. Hopefully we can manage some sort of a screenshot over the next few moments. But first and foremost, on behalf of the entire first responders first team, which includes our leadership, Ariana Huffington, who's the founder and CEO of Thrive Global, Michelle Williams of the Harvard School of Public Health, and Deborah Marcus, who's the executive at the Creative Artists Agency Foundation, who is currently on this call right now. We would just like to offer our sincerest congratulations to all the finalist teams. I think Linda mentioned it before, but I can just say that from First Responders First, we started this work at the beginning of the pandemic, and we have always taken a listening first approach, because we have been so inspired by the overall resiliency and strength from the healthcare workers and all those, really showing up for us on the front lines, and those even on the back lines that may not get noticed as frequently. So we're just so honored to be a part of this, and we would love to offer you our congratulations for even getting to this moment and sharing us with us your ideas. So as was shared, Linda shared the teams were all inspiring. We wish we could have funded them all. It's a sentiment that the judges shared as well. But as we all know, we have a pool of $250,000, which unfortunately doesn't allow us to fund them all. And while we entered this day anticipating to fund one team fully for the project, the judges were just so moved and really motivated by the pitches that they have decided to fund two teams fully, and then with an additional stretch of a little top up from First Responders First, provide a Kickstarter grant to another organization to really invest in this work. So we are so excited for the next piece of this. Drum roll, please. The first organization that is receiving full funding, Nico, if you could go to the next slide, is Geisinger Clinic, the Pause to Reflect team. I see their faces. They're very excited. The team includes Dawn Snyder, Brittany Drum, Stephanie Andriacci, Casey Marfit, Tina McDowell. While you may have signed up for one of the buckets of our priority areas, including EAP is not enough, do more, this fit different buckets of our priority areas. And we really feel that this is a great way to not only encourage workers to engage in mental health and well-being support, but with a new lens on it through dog meetings. So congratulations, we're so excited.
Thank you all so much. We are very excited too. Thank you.
I'm very honored.
And on to the next organization, the NYU Langone Smart Scheduler Program. The team includes Kathleen DeMarco, William Winfrey, Ilana Springer, and Eric Gruskin. And again, we felt that this really fit a number of different buckets that we identified in the Healthcare Workforce Rescue Package created by All in Wellbeing First for Healthcare, and really helped to take a unique approach to not only scheduling, but also taking into account fairness and a lot of different elements that may be missed by other programs. So congratulations, NYU Langone. We're so excited for you. And to extend the goodness, we will also be providing Kickstarter funding to the Children's Hospital of Orange County Deer Hospital program. The team includes Jennifer Hayakawa, Melanie Patterson, Charles Golden, Cynthia Neiman, Claire Driscoll, Sharon Herbert, and Jody Bepler. And this is a project that really, I think we can all agree, remains with us visually, even beyond this Pitch-A-Thon. And we really hope that providing some of this Kickstarter funding and potentially more to be attracted in the future, that we will help to inspire storytelling, which really helps to move the needle on behavior change and really increase well-being and joy at work. So congratulations, Children's Hospital of Orange County. And back to you, Linda.
Great. Thanks so much, Kasha, and congratulations to all the teams. That's just awesome, awesome, awesome. I know that it's been a long afternoon for all of you as you put so much work into this. And again, we just, as the presenting group, we just wanted to thank you all for your time, your attention, the work that you've put in. And because we all know as presenting sponsors that for healthcare to work, it takes nurses. So I encourage all of you to keep innovating, keep problem solving, keep pushing those boundaries, keep finding ways to get your teams to listen and to drive change, because we just came out of a pandemic. And as Julie Kennedy Aylert has said many times, never waste a crisis. So let's learn from this crisis that I think you all have lived through, and continue to build and innovate, because we certainly know that we need you to continue to move healthcare forward. So thanks, everyone. Have a great evening, and we will look forward to seeing you again in 2023.
Congratulations, everyone. Thank you.
Congratulations.